Tonight it's about the health care plan. Numerous plans circulating around the United States from various sources. Presidential candidates all seem to say something about a health care plan. And the Governor Schwarzenegger, has a health care plan, and so do legislators. And so Hal Holman is back with us tonight, and we're very lucky to have him, and he's going to have a conversation about health care plans. We'll see whether we can give you some insight into how you might evaluate them and understand them. And so the first thing to do, if we are saying there's so many plans, is why are we getting a flood of plans at this time?
Well, the main reason is that the major healthcare crisis, and the crisis, of course, everybody knows, is a product of increasing costs, which have resulted in reducing the benefits that people have from their insurance and preventing many people from even being insured. But in that crisis, the politicians find it necessary to be proposing different solutions to the crisis. And there are about 3 categories of solutions.
Right. And one is the market.
Yes, the first one is the one that is really a derivative of what we've had for decades, namely that there is a free market in healthcare and people obtain the healthcare by purchasing insurance from private insurance companies that are mostly profit-oriented, and in that way, the insurance companies will then, through the insurance plan, pay for care.
And the Republican presidential candidates are mainly on the side of saying somehow to maintain that system.
Yes,
and
do
really
nothing.
Not replace it.
Basically, they believe in what they call market justice, and that means that in economic terms, the market will solve whatever problems there are.
And that goes directly against the idea of a health crisis. If you really accept that there is a health crisis in the United States, you can't very well end up by saying we ought to keep doing the same thing.
That's precisely the point. The healthcare crisis is a product of the system we've had, which is basically a private insurance system.
Right. And at the same time is a private system of professionals.
Well, that's true. There are professional physicians, and by and large, they and other health professionals are paid on a fee-for-service basis, in which they are paid some set fee. Sometimes they set the fee, sometimes the insurance company sets the fee, but some set fee for each service they provide.
But it's in this context that we hear from Republican presidential candidates that the Democrats, which I might say are for regulation, they're maintaining the private insurance companies and they want to regulate them. And some want to regulate them more aggressively than others, but that's the essential point. And as you mentioned right at the beginning, we don't want to get into too fine a point. Actually, most of the Democratic candidates for president are in the same ballpark.
That's correct. They all recognize that the present system is largely responsible for the crisis, but they don't want to change that system substantially. So all of their plans, in one way or another, involve some form of government regulation of the behavior of the private insurance companies.
Right.
And that regulation may limit their profits or may require that they insure anybody who wishes insurance, but it would regulate private insurance and leave that insurance as the main financial mechanism of healthcare.
And as we go through our conversation tonight, it's very, very interesting as to whether that is really feasible in terms of some sort of feasibility financially. For example, Massachusetts it was one of the first states that really brought that kind of program to bear, mandated people to have insurance, and they go through the private insurance companies. And the latest thing that I have read that you gave me was by a group of doctors in Massachusetts that said it's a complete disaster.